On the heels of LeBron James' son Bronny suffering sudden cardiac arrest during basketball practice at the University of Southern California, news of the same thing happening to a high school basketball player, this time in Alabama, and sadly that 17-year-old didn't survive. Caleb White was called one of the best high school basketball players in the country. He attended Pinson Valley High School northeast of Birmingham. He, like Bronny James, went into cardiac arrest on the court. Dr. Athira Nair is a pediatric cardiologist with USA Health in Mobile. Thank you so much for joining us. Is it more common than we realize for this to happen to young basketball players?
Yes, so 1 in 44,000 athletes between the age of 17 to 23 actually have a sudden cardiac event or death. And when it comes, that risk goes up when you're African American, a male, and you're playing basketball. It goes to 1 in 2,000. That's pretty much a 22 times increased risk. And that's because basketball has more short bursts of energy, exercise along with the endurance part, and then static and dynamic components of exercise. So it's thought to be one of the riskiest, yes.
So, doctor, these young players have physical exams before signing on to a team, and they do not have to have any pre-existing heart conditions for this to happen, correct?
Sometimes they can be symptomatic. They can have chest pain or shortness of breath or dizziness or something, but most of them don't. And that first event is usually their last or their fatal event.
Are there any warning signs other than you said maybe shortness of breath in the hours, moments prior to it happening?
A lot of them may experience some dizziness but typically it's a sudden event where the heart is going into an abnormal heart rhythm and they collapse because there's not enough blood to the brain and the heart.
So are these physicals enough? Is there something more that needs to be done? Because I did read some research saying, maybe you don't have any health conditions as far as cardiac conditions, but maybe your mother does or your father does. Is that correct?
Yes. So a detailed screening is very important. So there are two prongs to improve our prevention of these deaths. One is pretty detailed screening that includes getting a family history. It's very important for parents to divulge any family history that might be there in the family, including things like hypertension, if those conditions need to be controlled. But the other thing is also how to resuscitate these patients effectively within that first minute that they go down. And that's where locally we have the Project Adam, which renders, physicians go out to the schools and show the proper use of CPR and AED and make these heart-safe schools. And predominant Baldwin County schools have all taken up on this. Mobile County is yet to catch up. But we encourage every local school to sign up for being a heart-safe school. But nationally, the Senate has passed the HB 45 Sudden Cardiac Arrest Prevention Act, where information needs to be given to the families and the patients and the coaches. And there's very rigorous kind of guidelines on what is needed to prevent and how to resuscitate these patients. Along with the Secretary of Health and Human Services is awarding grants to certain entities to be able to give this comprehensive program to promote student access to defibrillation in elementary schools and middle schools, high schools.
Doctor, what is the likelihood that a player will survive a cardiac event like this? And if they do, what sort of changes, if any, should they make as far as their lifestyle?
So within the first minute of going down, so your brain can take about 2 minutes of not having oxygen and blood supply or reduced blood supply. And so within that first minute, getting them resuscitated is the most important part. And if we can get them back within that first minute, the chances of survival is much higher than if there is delay in getting that care. So effective CPR and effective defibrillation out of a fatal abnormal heart rhythm is key. Now, returning back, it depends on what is caused. Some athletes, they get a direct hit to the heart. It's called commotio cordis, and it hits at a part where your heart starts having an abnormal heart rhythm. They don't have genetic conditions that's abnormal. They don't have any reason except that trauma. Now, those patients need to be looked at properly, screened appropriately, and told about the risks, and then may be able to go back. Some people may need a defibrillator implanted into them to be able to get them out of these. So it kind of depends on what it is and why they're having it.
So again, you said it could happen to any athlete, any sport. So it's so important for everyone, including coaches, to know how to react should something like that happen. Thank you again for joining us, Doctor. We appreciate it. And thank you for trusting us to deliver your news.